In this video, we have explained how drug of abuse like heroin can cause physical and psychological dependence.
And do not forget that heroin users changes our brain's reward system, leading to tolerance, cravings, and withdrawal symptoms.
These effects trap users in a cycle of repeated use, making addiction a serious medical condition.
We also highlighted the dangers, including overdose and social interactions.
Prevention, early intervention, and support systems are very crucial to help break the cycle of addiction.
So that's all from us. Thank you for watching. Stay informed, help spread awareness, and let's fight drug abuse together.
Heroin, also known as diacetylmorphine, is a semi-synthetic opioid derived from a morphine, a natural alkaloid found in the opium poppy. It is first synthesized in 1874 by English chemist C.R. Alderite and later marketed by the German pharmaceutical company Bayer in 1898 as a non-addictive substitute for morphine. Heroin was initially used to treat respiratory diseases and as a pain reliever. However, its rapid conversion to morphine in the brain and strong euphoric effect lead to widespread misuse and addiction. By the early 20th century, heroin's high potential for abuse became evident, leading to its ban for medical use in many countries and its classification as a Schedule I controlled substance under the United Nations 1961 Single Convention on Narcotic Drugs.
For mechanism of addiction heroin, firstly, heroin crosses the blood-brain barrier quickly due to its high lipid solubility. Once in the brain, it is deacetylated into 6-MAM, which is 6-monoacetylmorphine. Then, it's converted into morphine, which is active metabolite. So, the active metabolites bind to mu-opioid receptor. When bound to mu-opioid receptor, the following occurs, which first inhibits adenylate cyclase, which leads to decreased CAMP levels. Second, opens potassium channels, which cause potassium efflux and result in hyperpolarization of neurons. Third, close voltage gated calcium channels, which leads to decreased neurotransmitter release. So results in inhibition of pain transmission and enhanced reward signal. Thus, decreased release of substance P, glutamate and also GABA. And then increased dopamine in the nucleus accumbens via inhibition of GABAergic interneurons. Lastly, euphoria and addiction occurs.
Dependent means the body and brain have adapted to a drug, so a person needs it to feel normal and avoid withdrawal. In heroin dependence, repeated use changes how the brain works. Over time, the user needs heroin just to feel normal. As this happens, tolerance also develops, which means they need higher and higher dose to feel the same effect. If they stop using heroin, the body reacts with withdrawal symptoms like muscle ache, nausea, anxiety, and sweating. These uncomfortable symptoms create strong craving and make it very hard to stop. Dependence has both physical and psychological aspects. It is a part of addiction, but not exactly the same. Addiction also means losing control over drug use and continuing even when it causes harm. Recovery from heroin dependence is possible, but it requires treatment, support, and time.
Mechanism of pharmacological tolerance to heroin. Firstly, mu-opioid receptor desensitizations. Repeated heroin use causes decreased receptor responsiveness due to receptors phosphorylations and beta-arrestin binding. Secondly, receptor downregulations. Continuous activations lead to internalizations and degradations of mu-opioid receptor, leading to fewer receptors available for binding of the heroin. Thirdly, intracellular activations. Chronic heroin use lead to upregulations of the CAMP pathway. This can reduce the effect of the drugs. Finally, metabolic adaptations. Enzyme inductions can increase heroin metabolism, reducing its effect.
Let's see the withdrawal symptoms of heroin. The withdrawal symptoms may vary according to the dependence, and the severity. Here are some examples of the withdrawal symptoms of heroin. There are insomnia, headache, runny nose and watery eyes, nausea and vomiting, sweating, diarrhea, anxiety, tachycardia, muscle and joint pain.
Next, let's talk about the antidote treatment for heroin. The main antidote is naloxone, or also known as Narcan. It works by being the competitive opioid receptor antagonist, which binds with high affinity to mu opioid receptors. It also displaces heroin and reverses its effects, especially in CNS depression, respiratory depression, and meiosis, which is also known as pinpoint pupils. Next is routes of administration. It is preferred to be given intravenously, but also can be given through intramuscular, subcutaneous, or intranasal. The duration of naloxone is 20 to 90 minutes. Hence, repeated doses or continuous infusion may be needed.